Welcome to the BiPAP Respironics V60 Nursing User Guide. Today we will review indications for BiPAP, the user interface, removing patients from BiPAP, and placing the BiPAP on standby. BiPAP is intended to augment patients' breathing under the following conditions: respiratory failure, chronic respiratory insufficiency, and obstructive sleep apnea. Do not fear. This guide will help familiarize you with caring for patients using the model v60 BiPAP. Now let's take a look at the screen. The top portion of the screen displays the alarm silence button, alarms, current respiratory rate, current tidal volume, current minute ventilation, current peak inspiratory pressure, leak, trigger percentage, and more. The bottom portion of the screen displays the mode of ventilation, parameters such as set rate, pressure, volume, FiO2, and more. Let's take another look at the screen. At the top, we see the alarm status bar just above the patient data window. The midsection shows the waveforms window, and the bottom shows the window tabs. A closer look at the middle portion of the screen shows the waveforms of the current patient's breathing pattern as well as any current or previous alarms. A closer look at the blue section at the top shows that our patient is spontaneously triggering breaths at a rate of 16 breaths per minute with a tidal volume of 550 milliliters. Their minute ventilation is 8.8 liters per minute and their peak inspiratory pressure is 20. In this section of the screen, we can see our BiPAP settings. We have an inspiratory pressure set at 12, an expiratory pressure set at 4, a backup rate set at 4, and the FiO2 is currently at 21%. Here are a few examples why you may need to take your patient off of BiPAP. The patient may need to ambulate to the commode. They may be experiencing nausea. And they may require oral medications or suctioning. Here are a few things to remember when removing your patients from BiPAP. Use a non-rebreather, oxymask, or supplemental oxygen if needed. The patient may need to cough to clear secretions. Oral medications and meals eaten increase the risk of aspiration. When you remove a patient from BiPAP, it often alarms a lot. In order to prevent excessive alarms, you can place it in the standby mode. The bottom portion of the screen has a series of tabs. Select the standby tab and this red screen will appear. Warning: when in the standby mode, the BiPAP machine will stop ventilating if no breath is detected or if the leak is excessive. So please only utilize the standby mode if you are removing your patient and placing them on another supplemental device or if they're stable enough to remain off of BiPAP. Here's a review of some of the things we covered today. Indications for BiPAP, the user interface or the screen, removing patients from BiPAP, and placing the BiPAP in standby. We hope this familiarizes you with the Respironics V60 BiPAP. If you have any further questions, please contact Lisa Burton or the Respiratory Department.